Hi, I'm Hasan, Chief Medical and Healthcare Officer at Vitality. I'm really pleased to introduce you to the first in our new series of videos called Clinically Speaking. What we're intending to do is to provide you with an update every week on our YouTube Vitality Advisors channel, giving you an update on the latest information on what's happening in health and care. We're really pleased to be able to do this for our advisor community to share with you some really novel and fast changing things that are happening in the world of health and care. Today, we're going to be talking to you about the relationship between COVID and healthy living. We all know that the pandemic has significantly changed how we live, work, play, and interact with others. What's become very clear to us is that there is an incremental impact of not looking after your numbers, your diet and your weight, your levels of exercise and how much time you spend on a week, and whether you smoke. It's well known that these conditions can give rise to heart disease, obesity, cancers, and a whole range of other conditions. What's emerging with the huge amount of research that's being undertaken on COVID is these conditions that result from modifiable lifestyle factors could also seriously affect your outcomes if you catch COVID. We all know that age is the most prominent risk factor for the outcomes that you have in COVID. And in hospital, your chance of not surviving is roughly a tenth of what it is if you're under 40 compared to people at ages 50 to 60. However, this doesn't mean you should be complacent, because if you have some lifestyle risk factors or conditions related to those, they can seriously increase your risk of not passing through. If we look at the impact of BMI, your body mass index, we know that people with a BMI of 30 to 35 typically have a risk of fatality that's 25% higher than those with a lower BMI. However, if we look at the heaviest group of people with a BMI of 40 or above, their risk of not surviving COVID in hospital is 125% higher approximately. We also know that cardiovascular disease can significantly increase the likelihood of people not surviving COVID. Diabetes is also another significant risk factor and can provide you with a higher likelihood of dying with COVID in several multiples of what your risk would be otherwise. However, positively speaking, if people are able to control their diabetes and improve it, your risk becomes significantly lower. We all know that during the pandemic, it's much harder to maintain a healthy lifestyle. The New Scientist reported that over half of people are finding it harder to have decent, high quality sleep every night. Another study looked at people in America and showed that the average American may have gained up to 5 pounds during the pandemic period. That's why it was so important for us at Vitality, when we saw the impact that the pandemic was going to have, to really quickly mobilise our Vitality at Home proposition. We know that it's not been easy, and we know that the next few weeks and months are going to be periods of huge amounts of change. It's the most uncertain period I've encountered in my life. However, it's really important that we all keep supporting and encouraging each other to ensure that we have the right diets, to ensure that we undertake the right amounts of exercise and avoid smoking, and engage in other behaviours that make sure that we can continue to live healthy, happy and active lives. I'm really grateful to you for listening to this podcast. I'm Ali Hasan, and hopefully I look forward to connecting again next week. Thank you.